Hello, everyone. My name is Stephen Winkelman. I am the coordinator of incubator projects at the Ontario HIV Treatment Network and an MPH candidate at the University of Toronto. I'm joined today by Dr. Patrick O'Byrne, who is a professor of nursing at the University of Ottawa. Today, we're here to discuss at-home HIV self-testing during COVID-19, an overview of the Getakit initiative in Ottawa. I'd like to start off by announcing that we have no conflicts of interest or financial conflicts of interest to disclose, and this project was funded by the Ontario HIV Treatment Network. To provide some background for this project, during COVID-19, people in Ontario experienced limited access to HIV testing as resources shifted to meet the needs of our provincial pandemic response. However, people continued to engage in sex with new partners, presenting an increased risk of HIV transmission. In response to this gap in testing access, the Getakit HIV self-testing program launched in July 2020. This program was led by the University of Ottawa through Dr. Patrick O'Byrne, as well as the Ontario HIV Treatment Network, in partnership with the AIDS Committee of Ottawa, Max Ottawa, and Ottawa Public Health. Getakit began in July 2020 as a pilot to evaluate mail-out delivery of free HIV self-tests in Ottawa. Our objectives were 1, to assess the feasibility and accessibility of an HIV self-test kit in the Ottawa region, and 2, to determine the impact of the Getakit program on HIV diagnosis rates and linkage to care. We wanted to know how many people use Getakit, who uses Getakit, what are the results, and are people being linked to care? This program was initiated before Health Canada approved the use of rapid HIV self-tests in Canada. However, the research team obtained Health Canada's special access approval to distribute Biolytical's Insti-HIV self-test in Ottawa on April 23, 2020. The team then received REB approval from the University of Ottawa on May 15, 2020. And as of July 20, eligible participants could register on www.getakit.ca to order kits. This image shows one of the kits in action. Each kit contained a rapid HIV self-test, a workstation to organize kit components, linkage to care and support contact details, and HIV prevention materials. This slide provides a brief overview of the Getakit Flow. Participants could register online at www.getakit.ca, where they would perform a self-assessment, which asked questions such as demographics, age, sexual orientation, risk practices such as sex and drug use, and healthcare practices such as prior testing history. Participants would then receive the kit, order the kit to their home, perform the test, and receive the results. Participants were encouraged to report the results on www.getakit.ca, but they were not obligated to do so. Getakit utilized a status-neutral approach, meaning that all participants were linked to care, whether their result was positive or negative. For the eligibility of this project, participants had to be 16 years or older, be HIV negative or have an unknown status, be residing in Ottawa, not currently on PrEP, not currently enrolled in an HIV vaccine trial, and with no known bleeding disorders. I will now hand it over to Dr. O'Byrne to discuss our results.
Thanks, Stephen. So as Stephen laid out quite clearly, the main question we had was in the throes of COVID-19 pandemic and the restrictions on access to healthcare, which resulted in actually around 75% reductions in HIV testing across Ontario during that time. What would happen if we had online free HIV self-testing available before Health Canada actually approved it? So the way the process went was we made all of this available as has been detailed. People logged on to do the eligibility screener. The items were for age and residence and PrEP use that Stephen just detailed. And what we had in the actual initial study period, the first 7.5 months or so since we launched, we had around 1,200 people actually log on and check their eligibility, of whom around half were eligible. Of the people who were eligible, then around 75% went on to actually register, to put in their name, their address, and actually validate the system using the cell phone, sort of a multi-phase authentication. And then of anyone who registered, everyone went on to actually complete the pretest survey, which got the information that Stephen detailed on sexual practices, risk practices, country of birth, and so forth. And all of the individuals who completed that proceeded to actually order a test as well. Next slide. For ineligibility, so I said around 1,200 people had actually logged on to check. There were a subset of people who didn't actually complete all the questions in the eligibility screener and were deemed ineligible. For people who actually completed all questions, which was the majority, 15% resided outside of Ottawa, and this was not just within the province of Ontario. We had people requesting tests from all over Ontario, but also neighboring into Quebec as well. We had 10% who were already using PrEP, and the ineligibility criterion there was basically just if you were already doing quarterly HIV testing with the 4th generation serology, sending out a point of care, the 3rd generation point of care, to actually add in additional testing wouldn't necessarily be useful. 8% said they had no cell phone, and so the actual validation into the site was not possible. 5% reported a bleeding disorder, and then 3% didn't meet our age threshold as we move through. Next slide, please. Now, the main question we had, as I keep going back to, is if you release this, if you roll it out as sort of an observational study, who is actually going to use our self-tests? Interestingly enough, we found that around a quarter of people, 24%, reported no prior history of HIV testing whatsoever. And so this came down from around 1,200 people who were eligible, who did the eligibility screener, to 50% or so, the 47% who were eligible, and then 75% who ordered, so bringing us down to a pool of around 420 people. So of those, 24% reported no prior testing, and an additional 3.5% actually were uncertain if they had ever done HIV testing again. So around 27.5 people were confirmed to have never done testing or uncertain if they had ever done it. So it reached out to people, right, who had never done this testing before. The next main question is, certain groups we know are disproportionately affected by HIV, and we want to know, right, is it members of those groups who are actually doing the testing? And we found that 71% of people who actually ordered an HIV self-test from us did belong to an HIV priority group. Of this, it was 54% were gay, bisexual, and other men who have sex with men. Approximately 10% belonged to African, Caribbean, or Black communities. Somewhere around 4 to 5% were members of Indigenous communities. 2% were trans. So that fell within our 71%. Additionally, we had somewhere around 29% of everyone who ordered identified as female. Skipping into the last, for the 61%, what we had was anyone who belonged to an HIV priority group, the ones I just mentioned, and reported a negative result onto the website. We then made an offer to them for PrEP to come into our nurse-led PrEP clinic. Of all of the results, the vast majority were negative, somewhere around 75%. There was a subset, 2 or 3% of people who just didn't want to report the result back to us. We had an invalid rate, somewhere around 10 to 20%, and then we had one person report a positive result to us as well. And that individual we connected to within a few hours of reporting the results, had them in the next day for confirmatory testing and linkage to care and initiation of treatment within 2 weeks from the time of reporting the result. Next slide. So going through all of this, as really the question was, if you're going to roll this out knowing self-testing was coming and subsequently has been approved by Health Canada, what are our lessons learned? And there's 3 main ones. One is the invalid result. The test itself, you have to basically poke your finger with the lancet. You need to get a big drop of blood that falls into the vial. Reaching out to people who reported invalid results, they said we were just using a minimal amount of blood. We were scraping it in. So we said use more blood. We sent a subsequent kit. These individuals reported non-reactive negative results back to us. The language that we use of non-reactive reactive is also confusing. That was a good lesson for us to learn. Typically, we think of HIV testing in relation to positive and negative and status of positive and negative. And so when we used reactive at the beginning, it did cause some confusion, and we promptly switched over to the typical, more broadly understood positive and negative. We also, seeing the 8% of people who didn't have cell phones, flexible communication strategies and ways to get on, we added in the ability to use an email and a landline to actually validate. Next slide, please. So as the last item, just to acknowledge our partners again, so Max Ottawa, the AIDS Committee of Ottawa, and Ottawa Public Health. And just as a closing, again, we have no disclosures to make. The study was funded by the Ontario HIV Treatment Network, and we have no conflicts of interest to declare. Thanks for coming and listening.